Non-suicidal self-injury. Myself, Rashmi Mishra, Department of Psychology, PPN College, Kanpur. Outline of discussions. What is non-suicidal self-injury? Now, non-crisis first aid for depression and anxiety. And third one is crisis first aid for panic and traumatic events. Non-suicidal self-injury is defined as intentional destruction of one's body tissues without suicidal intent for purposes not socially sanctioned. NSSI including cutting, skin eroding, skin cutting, scraping or carving, burning and hitting and banging. Three types of NSSI: major NSSI, stereotypic NSSI, and superficial to moderate NSSI. Major NSSI include extreme but rare act typically observed severe psychosis. These acts are self-imputation, eye inclination, and self-castration also tend to occur throughout, not always, just once, and involve the use of an implement. Stereotype NSSI tend to occur quite frequently, tend not to involve the use of an implement and result in superficial and minor tissue damage. It tend to occur in the context of a developmental disability, neuropsychiatric disorder that is repeated head banging and biting one's tongue or extremity. Superficial to moderate NSSI include superficial to moderate NSSI refers to the type of behavior can be compulsive, episodic, or repetitive. Compulsive NSSI refers to that are non-severe and non-ritualistic in nature, including hair pulling, episodic, and repetitive NSSI are similar in the method use cutting, burning, or hitting, but differ in terms of act frequency. NSSI typically begins between the age of 12 to 16 years, approximately 10 to 15% of adolescents and self-injured at least one. Lifetime rate of NSSI in adults are only about 4%. NSSI rates are similar female and males, although females are more often cut and males more often hit or bang. Psychological intentions underlying NSSI demonstrate that behavior serve a variety of functions, both interpersonal and intrapersonal, that are not mutually. The first attempt to describe this behavior can be seen in the book Man Against Himself, Menninger 1938, in which the author defines self-injurious behavior as a sort of partial suicide. Etiological factors, these factors are divided into two categories, individual and environmental. In individual category, emotional degradation, deregulation, psychiatric disorder, and environment, childhood maltreatment, attachment, and disruption. Self-injury system and signs, scars, fresh cut, excessive rubbing, keeping sharp object on hand, wearing long sleeves or long pants, even in hot weather, frequent report of accidental injury, difficulty in interpersonal relationship, behavioral and emotional instability, impulsivity and unpredictability, a statement of helplessness, hopelessness, and worthlessness. Self-injury, forms of self-injury are cutting, scratching, burning, carving, self-hitting, piercing the skin, self-inserting objects under the skin. Causes of self-injury are poor coping skill and difficulty managing emotions. Self-injury, why person use self-injury? Manage or reduce several distress or anxiety and provide a sense of relief. provide a distraction from painful emotion through physical pain, feel a sense of control over his or her body, feeling or life situation, feel something, anything, even if it is physical pain, when the feeling emotional empathy, express internal feeling in an external way, communicate depression or distressful feeling to the outside world, be punished or perceived fault. Risk factors are having friends who self-injure, life issue, mental health issues, complications, worsening feeling of shame, guilt, and low self-esteem, infection either from bound or from sharing tool, permanent scars or disfigurement, severe, possibly fatal injury, worsening underlying issues and disorder if not adequately treated. Preventions. Identify someone at risk and offer help. Encourage expansion of social network. Raise awareness about the warning signals of self-injury. Encourage peers to seek help. Talk about media influences. Anxiety is a common emotion when dealing with daily stressor and problem, but when these emotions are persistent, excessive, and irrational and affect a person's ability to function, anxiety become a disorder. These kind of anxiety disorder are phobic, panic, and stress disorder, obsessive compulsive disorders. Symptoms are apprehension, confusion on edge, a sense of helplessness, repeated negative thought, muscle tension, palpitation, and difficulty breathing. Treatment. Simple strategies are relaxation technique and regular exercise and psychotherapy. Depression is a low mood that lasts for a long time, affecting everyday life. It's triggered by a mix of genetic, psychological, and environmental factors. Studies shows that the risk of becoming depressed can be increased by life events such as poverty, death of a loved one, physical illness, and sometimes it is risk is also hereditary. Symptom: persistent sadness, loss of interest in activities, loss of appetite, feeling of worthlessness, becoming easily agitated, among others. There is some mental health first aid for depression. This is five-step action plan called LAG. Assess for risk to suicide or harm. Listen non-judgmentally. Give reassurance and information. Encourage appropriate professional help. Encourage self-help and other support strategies. A stand for assess for risk of suicide or harm. Second one is listen non-judgmentally. Never take any judgment to such kind of person. Say that I am concerned about you. How long have you feeling this way? Have you spoken to anyone about this behavior? Such kind of sentences should be expressed. But some sentences should not be expressed, like snap out of it, get over it. You should not trivialize the person's experience by pressuring them to pull a smile on your face, get your act together, lighten up. You should say, you don't seem that bad to me. G stands for give reassurance and information. Depression is real, treatable illness from which people can and do recover. When talking to someone you believe may be experiencing symptom of depression, approach the conversation with respect and dignity and don't blame the individual for their symptoms. E. Encourage appropriate professional help. There are many professionals like physicians, counselors, and other mental health professionals and peer support specialists. Mind. Talk therapy is very much important, very much useful. and applicable. Medication and other professional supports are available. E stands for encourage self-help and other support strategies. This can also be very useful for the person. Panic attack symptoms are shaking, sweating, numbness, dizziness, heart palpitation, chest pain, abdominal distress, shortness of breath, fear of going crazy or dying, chill or hot flashes. How to help such kind of panic attack persons? This is LG is action steps. Assess for risk of harm. Listen non-judgmentally. Give reassurance and information. Encourage appropriate professional help and encourage self-help and other support strategies. Traumatic events, any traumatic events from a person, tragedy is a global crisis, can take an emotional toll and cause traumatic stress, but there are ways to regain control of your life. Emotional response to traumatic events are maybe a traffic accident, plane crash, violent crime, terrorist attack, global pandemic, or natural disaster like earthquake and flood. A person may feel intense shock, confusion, and fear, or feel numb or overwhelmed by a host of conflicting emotions, sometimes all at once. Social media should be avoided for such kind of traumatic events because it exaggerates the traumatic events. Emotional signs and symptoms of traumatic stress, shock and disbelief, fear, sadness or grief, helplessness, guilt, anger, shame, and relief. These are emotional symptoms. And now I'm going to discuss physical symptoms. Feeling dizzy or faint, trembling, shaking, rapid breathing, racing thoughts, change in your sleep pattern, if unexplained ache and pain, lose or increase in appetite. 13 ways to stop panic attack and traumatic events. These are 13 ways which person can use very easily to anywhere, to anyone, and in any condition. Remember that it will pass. Nothing is permanent in nature. This traumatic event or panic attack will be passed out after some time. It is for temporary phase. Take deep breath. Deep breath is very much important for eliminating the distress and panic attack. Smell some lavender or any smell which is very soothing for the person. Find a peaceful spot, a place from where no noise and hustle and bustle, so person can feel calm and quiet. Focus on an object. Always, when you are in a traumatic event, focus for something, any kind which you feel that it is important for you, you can focus. Sixth one is the 5-4-3-2-1 method. 5-4-3-2-1 method is very, very useful and applicable. Look at 5 separate objects. 5 अलग अलग चीजों को देखिए. Listen for 4 distinct sound. 4 अलग अलग आवाजों को सुनिए. Touch 3 object. 3 प्रकार के ऑब्जेक्ट्स को, वस्तुओं को टच करें, छुएं. आइडेंटिफाई 2 डिफरेंट स्मेल. 2 प्रकार की स्मेल्स को आप पहचानिए. नेम 1 थिंग यू कैन टेस्ट. किसी एक चीज का वर्णन कीजिए जिसे आप टेस्ट कर सकते हैं. सो these 5-4-3-2-1 method. Look at 5 separate objects. Listen for 4 distinct sounds. Touch 3 objects. Identify 2 different smells. Name 1 thing you can taste. This is the method of 5, 4, 3, 2, 1. Repeat a mantra. Which type of worship you are doing? You should take a mantra and repeat. Mantra repetition is a kind of catharsis of emotional trauma. So repeat a mantra, walk or do some light exercise. Try muscle relaxation technique. As above I have mentioned already, progressive muscular relaxation technique is very useful in panic attack. पिक्चर योर हैप्पी प्लेस, कोई ऐसा स्थान जो आपको बहुत सुखद लगता हो उसको आप इमेजिन करिए. टेक एनी प्रिस्क्राइब्ड मेडिकेशन, यू कैन कंसल्ट इट विद ए डॉक्टर. टेल समवन, अपनी प्रॉब्लम्स को शेयर करना. शेयरिंग इज वेरी मच इम्पॉर्टेंट टू मिनिमाइज द पैनिक अटैक एंड ट्रॉमेटिक इवेंट. इफ यू शेयर, you will feel some lighten in himself, within self. Learn your trigger. You should know what is your trigger which create panic attack and traumatic events. So this is, thanks for watching this video. Thank you very much.